Did you know intense breast pain while breastfeeding is completely normal? Hey moms, I'm Dr. Shauna Mason. I'm a board-certified OBGYN practicing here in Houston, trying to help moms have a better delivery experience and a smoother recovery postpartum. And I think that breast pain, especially nipple pain, in the first few weeks that you are getting started with breastfeeding catches most of my patients by surprise. And I think it's something we often forget about whenever we're trying to breastfeed subsequent children. So let's talk about pain, why it's normal, things you can do to help give yourself some relief, and when to be worried that maybe it's more than just normal transitional pain. It's important to get help when you are in the hospital to make sure that your baby is latching correctly. Nipple pain because of a poor latch from your baby is not normal, and that we want to make sure that right out of the gates we are training both you and your baby to latch correctly so that we don't cause unnecessary trauma to the nipple. What I think catches so many women by surprise, because it's not talked about enough and it's not included in many breastfeeding classes, is that pain at the nipple and with letdown. That means as the milk comes out of the breast and through the nipple into your baby's mouth, there is intense pain. So let's go over some of the hormones that are responsible for this, and then we're going to cover ways to get some relief. Prolactin. This is a hormone that comes in our brain, and we don't make very much of it unless we are breastfeeding, and then our bodies amplify it up in the 100 times. So as our bodies are increasing prolactin and our breasts are learning to make milk and store it until we need to feed our babies, the breasts are going to get really full. And that can cause breast tissue pain, fullness in the breast, and this happens about 3 to 5 days after you deliver. Regardless of whether you have a vaginal delivery or a C-section, the breast will eventually fill up with milk. What we make in the first few days until that milk production happens is known as colostrum. Colostrum is low in volume, high in antibodies, calories, and fat. So it's very, very nutritious for our babies, but we don't make very much of it. Now, this is actually a very good thing because our babies' tummies are so tiny when they're first born, about the size of a grape or even down to a blueberry. And so it doesn't take much to fill them up, right? But they also use those resources very quickly, which is why they cluster feed so often in the first few days of life. Now, this is a supply-demand issue, right? If our babies are hungry every 2 hours, and that is going to rev up that prolactin production, so our bodies start making more milk that then we store in the breast until it is time to feed our baby again. Engorgement is one of the number one causes of breast pain, and it happens usually 3 to 5 days after you deliver and can last for about a week or 2, depending on how quickly your body gets the hang of how to make milk and release it and only make as much as your baby actually needs. The other very common reason people have intense pain is with letdown. So what this means is that when your baby latches and starts sucking, suck, this is what sends signals to our brain to increase the release of oxytocin, which is the same hormone that we use when we are having labor contractions. That's right, Mom. The same hormone that gave you contractions if you were in labor is the same hormone we need to let that milk out of our breast through the ducts at the nipple. So that oxytocin, we know, is a very, very powerful contracting hormone. And so then pain at the nipples with letdown can be out of this world crazy intense, almost like there are razor blades or suctions there that are at maximum capacity. It is just so painful in the first 2 to 4 weeks that you've had your baby, that you're getting the hang of all of these chemicals flooding our body, until that intensity from the oxytocin at the nipple kind of lightens up or lessens up, and then the letdown becomes so much less painful. I mean, I remember when I was breastfeeding my kids and it was time to breastfeed in those first few weeks, I would just dread putting them on because the pain with letdown was so intense. And I even went and saw a breastfeeding specialist because I was convinced we were doing something wrong because the pain was so bad. But it actually wasn't. We had a very thorough workup. Nothing was found, and I believe it was just that my body had such an intense response to that oxytocin as it let the milk out. Once the baby was latched, I just would have to hold on to something. So I think a stress ball can be really good to keep handy in those first few weeks while your body's getting the hang of this, so that you have something to squeeze on as that pain really peaks. Usually after the first few minutes of your baby being latched and that initial letdown reflex eases and the milk kind of flows freely as your baby sucks, then the pain lightens up. So those are the two main reasons that are normal physiologic changes that happen at the breast that allow us to breastfeed our baby that can be crazy painful. And I just don't think that this is talked about enough out there. And so I think we get online and we start searching breast pain and we think we have mastitis or we think that we have yeast in our nipples. And those things can happen. Those are red flag problems when pain isn't getting better. Physiologic changes that happen in the breast that allow us to breastfeed can be crazy painful, even when you're doing everything right and there's no infection and there's no cause for it. There can also be trauma to the nipple, right? Just from your baby being like a little piranha sucking on there. So this can happen even if you have a good latch. So things that can help with that: one, making sure you have a good latch. So every single time, even when you're frustrated, even when your baby's frustrated, you want to make sure that you get them on correctly. And if they aren't, you make them try again. That means pop their little mouth off of that nipple and try again. And it's really important that the whole nipple get into their mouth. And there are tons of great videos out there that can show you how things should look from your point of view and your baby's point of view if the nipple is in correctly. It's also important to switch up positions. So think about your baby's mouth attaching to the nipple from different directions. So if you're always putting your baby on in the same hold, then they are always going to be sucking the nipple from the same pressure points. So changing positions, even if you're more comfortable in certain positions throughout the day with nursing feeds or even day to day, can allow your baby's mouth to grab the nipple from a different pressure point to give some relief on an area that might be getting sore just from repetitive use. This is also where your breast pump can come in really handy. If you are noticing abrasions on the nipple from your baby's latch, pumping from that side and then either giving your baby that breast milk from a bottle or a syringe can allow the nipple to heal, even if you do it for half of your feeds during the day or for one full day, because the shield, the nipple phalange, if you will, that attaches to your breast pump is going to give pressure points circumferentially around the nipple, and the nipple is going to be able to be pulled through with less tension and friction there. So this is something you can do if you're having abrasions or sores or bleeding or even blisters on the nipple from the pressure of your baby's mouth, trying different holds if you can, and then using your breast pump to basically get relief so those little areas can heal. Thankfully, the nipple tissue, if you catch it early and you're staying on top of this, will heal fairly quickly. So these are the common reasons that breastfeeding can be so painful, even in moms who are doing everything right. So let's talk about some ways you can get relief. So I think that these hot cold packs that you can find, this is one brand that's very popular, grabbed this at Target, that you can stick inside your nursing bras, are so helpful in either providing heat relief for milk letdown, or after you nurse, the breast can feel really sore just from the contractions of the milk letdown. And so you can pop them in the freezer or pop them in the microwave, whether you feel like you need cold relief or heat relief. And these can be really amazing, especially in those first few days where engorgement is so common, to just give your breasts some like love and care, right? They're just cozy, really great nipple cream. So the hospital has nipple cream like lanolin. Not everybody likes that. Not everybody's skin works well with that, but I still think it's a great nipple cream for lots of women. They make natural ones, nipple butter. You can use Aquaphor. This is a great viscous barrier to the nipple. And I think the biggest thing I recommend for my moms who are breastfeeding, who are having intense nipple pain, is to put this stuff on before you get in the shower. So all you want is a hot shower to relax your sore and aching body. And it's so good for engorged breasts, but it can feel like lemon juice in a cut or razor blades at the nipple if they are raw and irritated. And so just putting some Aquaphor all over the nipple before you get in, or your nipple butter, these things can create a barrier, almost like a temporary Band-Aid, if you will, so that you can actually face forward in the hot water and let the water hit your nipples. So Use this throughout the day. It's great hydration and moisture. This can really help heal them, but also use it before you get in the shower to give yourself that barrier. One of the things I swore by as a breastfeeding mom are these little hydration silicone pads. You keep these in the refrigerator and you put them on after you're done with the breastfeeding session. This cold relief, one, helps the breast kind of tighten up again so you don't keep leaking after you're done feeding. And also, it's just such great soothing relief at the nipples. And then you can wear them for 30 minutes until they warm up. Then you can take them off, put them back in the fridge. One pack, if kept clean and in the fridge, can last you about 3 or 4 days, and then you have to toss them out and get a new pack. But I use these religiously for the first 4 weeks of breastfeeding just to provide soothing comfort relief at the nipple. All-purpose nipple cream is something people come in asking for all the time. All-purpose nipple cream is a basically prescription nipple cream that you have to get at a compounding pharmacy. But I usually tell patients this is something you can kind of mock up at home with stuff that you might already have in your medicine cabinet. So all-purpose nipple cream uses an antifungal, an antibacterial, and a steroid cream. Bacteria and fungus live on us, things like yeast and other bacteria. Your baby's mouth also quickly gets colonized with those bacteria from our skin and their skin and environment. And so as you get sores or abrasions or weaknesses in the nipple tissue, those bacteria can kind of take advantage and invade. Ways to kind of help the nipple heal and provide yourself relief is to make your own all-purpose nipple cream. So you want to use something like Lotrimin or a yeast cream that you have. Use a topical antibiotic ointment, so polysporin, bacitracin, or neosporin are great things that most of us have in our drug cabinet, and then an over-the-counter steroid cream. You just put a, pea-size amount of all of these on your finger, all three, and then you just mix them all together and make a little cream. And then you can wipe this on your nipples after you're done breastfeeding, and that will kind of moisturize, heal the skin, and prevent any bacteria that might be trying to get in there and cause more problems than we actually need. This you can use several times a day. You're welcome to wipe it off before you breastfeed your baby. So you can also ask your doctor for that, and if there's a compounding pharmacy near you, then they can actually make a compounded version of that in a jar that you can just use all throughout the day. And it's good to alternate your all-purpose nipple cream with your just sort of regular hydrating nipple butter, Aquaphor, things like that. So these are things that I think really help moms sort of handle the pain with engorgement, the pain of letdown, and the pain of just abrasions as our nipples are sort of toughening up and getting used to the baby's mouth being there. Red flag warnings, right? When things maybe are more than just those 3 normal transitions for breastfeeding are things you need to see your doctor. If you get a bad abrasion where you are having nipple bleeding, you may need more aggressive treatment. So you would want to see your lactation nurse or call your doctor so that they can take a look at that abrasion and let you know how best to heal. Remember, it's okay to use your breast pump to give that pressure point some relief. Just think about wearing shoes and you're getting a blister and you have to cover it up or treat it, or just wear different shoes for a while until that skin heals and toughens up. The same thing happens at our nipples. There are also great little inserts. I couldn't find them for the video, but they are like little nipple teepees that you can slide into your nursing bras that allow nothing to sort of touch the nipple in those first few weeks until they're recovering. So if you have an area of your breast that gets really red and inflamed, this is always a red flag that maybe an infection is brewing. Sometimes we can get clogged ducts and they will get red and irritated. And there are lots of tips and tricks out there on how to unclog your breast. Heat and changing positions and using your pump are great strategies. But if the breast gets really red and tender, especially if it's in one area, this is a red flag. You need to call your doctor because there's a good chance that mastitis is starting to brew. If you have sudden onset of fever or you feel like you are getting the flu along with these red pain symptoms, this is classic mastitis. This is a very aggressive infection. This means bacteria from your baby's mouth, from your body, has gotten into a breast duct and has just multiplied very, very quickly because the breast milk is just like sugar for the bacteria. It's just like a feeding frenzy in there. And so you can go from feeling just a little bit off to being very sick with high fevers, body aches, chills, and just no energy very fast. And this can become even a bigger problem if not treated. So it's good to see your doctor, talk about when antibiotics might be safe for you and your baby, and know if things aren't getting better, when you might need to be more worried that something more aggressive is happening, like a breast abscess. The last thing is ductal yeast infection. So these are actually pretty hard to diagnose because we can't really grow out yeast in the breast milk. And it's not actually in the milk the way mastitis is. This is sort of yeast affecting the tiny milk ducts. This is classically described by moms as just deep pain. So not just the letdown pain when the baby starts sucking and the milk starts coming out. That pain comes and then goes. This pain is deep into the breast tissue, so from the nipple pushing back into the chest. That happens even after you've stopped breastfeeding. So we're done with the feed, and then that intense razor blade, sharp, throbbing pain is pushing through the breast even after you've stopped breastfeeding. This often happens in one breast, not both, although it can present in both. If you feel like this is more than letdown, or you are way past the pain of letdown stage and this starts happening, this is something you want to see your doctor about. Oftentimes, babies might be diagnosed with thrush at the same time that moms are experiencing this pain. Thrush is when yeast attacks the baby's oral surfaces, so their cheeks, their tongue, the roof of their mouth. And so mom's symptoms and baby's presentation often go hand in hand. Treating you both at the same time can be really helpful in getting you both better. Knowing that breastfeeding is painful, I think, is not advertised enough. And I think breastfeeding is a wonderful experience for so many moms and babies. I think there's so much good that can happen when moms are successful at breastfeeding. But I think when we aren't told the reality of how often we're going to have to breastfeed, how painful it's going to be in the beginning, how hard it's going to be to figure out how to get your baby to latch, to know how to try different positions if you're having pain, to sort of understand how your body's going to figure out how much milk to make, right? All of these things, when we aren't told that they're normal, can set us up for failure because we start to worry that we're not doing it right or we're doing something wrong. Pure defeated because we're exhausted. We don't know what we're doing. We lose our confidence and we're in tremendous amount of pain while our body's already recovering from growing and delivering a whole person, right? So I think that we need to give airtime to some of the normal but less glamorous aspects of breastfeeding, which are time and pain. They usually get better for most moms by 3 to 4 weeks. They really feel like they are getting on a good schedule. Their body is figuring it out. They have overcome the pain with both engorgement and soreness of the breast swelling, and the letdown reflex is starting to be better established, and so that isn't causing them as much pain. Mastitis and yeast can pop up at any time, unfortunately, but those are the red flags you always want to be seeing your doctor about because those are not normal experiences for pain. But in the beginning, knowing that breastfeeding can be really painful, I think helps moms not panic that they're doing something wrong, and knowing that it will likely come to an end can really help moms stick with it if they're motivated. So I hope that this video has really helped you, especially if you are planning on breastfeeding or you're already breastfeeding and you're out there searching why this is happening to you. I very much hope that you and your baby get through this transition and go on to have a very wonderful breastfeeding experience. If you experience something breastfeeding that I didn't mention here and you are curious whether that's normal or not, please drop it in the comments below and share this with your breastfeeding friends or your moms who are expecting and thinking they may want to start their breastfeeding journey. I hope that it can really help all of you out there.